Well, for people who are having trouble sleeping, there's a world of over-the-counter sleep aids. You've got pills, gummies, teas, dissolving mouth strips, all claiming to offer a better night's sleep. And joining us this morning with some helpful advice that he provides to his patients is Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Center. Hello.
Good morning.
Good morning. So we are not talking about prescriptions. We are talking about the things you can buy at Walmart, Walgreens.
Right.
So there's a plethora that you can choose from.
So many,
melatonin,
right?
all those things. Do they work?
Sure. So, I mean, the reason that the market's there for it is because so many people are affected by insomnia, right? That's a place to start right there, so we can come back to that. But do they work? Some, you know, really don't work any more than placebo, right? And I say some, there's so many to cover there between the teas and the herbals and those things. However, I will say this, I and other doctors are very much open to, you know, over-the-counter remedies, right? If they work. The problem is some have not been studied, you know, rigorously enough to know the difference.
So give us an example of one that does work.
Sure, sure.
What do you think?
Well, there are things over the counter that will put you to sleep, right?
Okay.
So the antihistamine class, the Benadryls, the Unisoms, right? Like, no doubt that will help with sleep. But again, now we're talking about sleep quality.
Right.
So it's not just putting you to sleep, are you really getting good quality sleep from that, right? That's probably the biggest thing. It's not even induction of sleep with over-the-counters. It's their interactions with other medications and other over-the-counters, as well as, you know, the quality of sleep that you're getting from them. That's probably the biggest thing.
And how they make you feel the next morning, too, is sometimes an issue. And something that a lot of other people deal with is they have no problem falling asleep. They cannot stay asleep.
Right.
And these meds don't necessarily help with staying asleep?
That's correct. That's correct. So even before medications or over-the-counters, we try to preach sleep hygiene, right? And that has been shown to help longevity of sleep and quality of sleep. So those are basic things, like falling asleep or trying to go to sleep at the same time, waking at the same time every day, right? Trying to get your rhythm, your circadian rhythm in order, right? Okay. So for other hygiene-related, sleep hygiene-related issues, you can find those online, I'm sure. I want to spend time with that. But that's where the bedrock is. And then, really, if you need something to sleep, I would just say, let's talk about it. Come in, talk to your doctor about what options you do have, because there are options and there are over-the-counters that I'm certainly not against, right? It's just what's going to be effective, what's going to be truly helpful for you. Help you not waste money and time that you're not getting good quality sleep. So call your doctor if you're having some trouble sleeping, right? Right, I guess that's the answer, right? Yeah.
All right. Thank you so much, as Dr. Cockerell. Thank you for joining us this morning. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.